Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and in today's video we are going over part 3 or phase 3 of medial epicondylitis management or golfer's elbow management. So if you missed the first 2 videos in this 3-part series, kind of the acute phase to help you reduce your pain and the phase about restoring flexibility, those are 2 really important steps. It's not something that you can just skip ahead. When you're in acute pain, you really need to work through those first, so make sure that you check those out. I'm going to post the links in the description bar below, so make sure you check those out. As always, make sure that you seek care from your doctor or a rehabilitation specialist like a PT or an OT or a certified hand therapist before you start any exercise program. But this video we're going to talk a little bit about phase 3 to help you recover from your golfer's elbow injury or your medial epicondylitis. This is really the phase where we're talking about strengthening, reloading the tendons, putting a little bit of gradual stress on them as they continue to heal. So the exercises that I'm going to show you are meant to be added on to the stretching routine that you should already be working on, where you're doing sort of the postural exercises that we practiced and still the wrist exercises that we practiced. Let's get into it. So for these exercises, you are going to need something light that you can use, either a small weight that is probably 5 pounds or less, maybe a water bottle filled with rice, or a hammer, a soup can, something that you can easily hold on to but has a little bit of weight to it. And then you also want to be in a position where you can use either the edge of a table or an armrest, somewhere where your forearm can be supported but your wrist is able to move over the edge. So make sure that you have those 2 things, and let's get started. Hello! Okay, so I am tilting my camera down so that you are able to see. So this is going to be the area that I'm using. I'm using just my desk. This is not the best angle just for lighting purposes, YouTube, but find a spot that feels more comfortable for you to work in. So I have my weight here. This weight looks a little crazier than it actually is. Yeah, this might be a good angle. So what I'm going to do is I'm going to start with my, let me do this without the weight first. I'm going to start with I'm holding my weight. I'm going to start with my wrist in a flexed position. So I'm assisting it with the other hand to get it there. And then what I'm going to do is I'm going to lower the weight slowly and then use my other hand to help me back into that position. So again, it's a reverse curl. You're going to lower the weight slowly, use the other hand to help assist on the way back up. So we're not trying to do a regular curl where you're active in this phase. You're going to lower the weight down, slowly pick it back up. So let's go ahead and practice that with the weight next. So we've got our weight here. We're going to slowly lower the weight down, and then I'm going to use my other hand to help me pick it back up. You know what, this weight is so ridiculous. Let me see if I can find something that is smaller. My weights that I have just have like the world's largest looking plate, and they are not that heavy. They're like a super wimpy weight, but they look crazy ridiculous. So let me find something else and let's try this again. Okay guys, I'm back. I have my handy dandy hammer, which I use a lot, or I tell people to use these fairly frequently, because usually hammers are like about 2 pounds or maybe a little bit less, so they tend to be a pretty good household object that most people have that can be used as a weight for these kinds of exercises if you don't have one. So let's try that again. So I've got my good positioning. My forearm is going to be supported. I'm going to hold on to my weight with the hammer because a lot of the weight is at the tip. You want to make sure you're not holding it way over here. You want to choke up a little, hold close to the weight. And then I'm going to lower my wrist down and then use my other hand to help me back into a bent position. So again, lowering it down, using my other hand to support the weight on the way back up. And what I'm going to do is about 10 repetitions of these, nice and slow, really controlled on the way down, and relax on the way up. And I'm going to get a nice little workout. Now remember, this should not cause pain, so if you're starting to feel pain, you're probably not ready for this exercise, so you might need to back off. But that is going to be sort of your wrist eccentric to help work on the volar muscles, the wrist flexor muscles, and help to reload that flexor pronator tendon that typically is going under its healing recovery process. I would typically do, let me fix the angle here so I don't have to have terrible posture. Practice what I preach, not not what I do. Yeah, so anyway, I usually would say, maybe one set of, God, my brain just like literally flew out of my head. Anyway, maybe every other day so that your body gets a little bit of a break, right? We don't typically weight train the same muscle day after day because it needs that period of time to recover and rest. That's how we get stronger. If you overuse it, it may actually just make things worse. So I generally recommend 3 days a week for most of my patients for this exercise, about 3 sets of 10. If you cannot do that without pain, you probably need to back off a little bit, kind of come down to a lower level or lower intensity exercise. But that would be a really nice addition to your stretching program, to your postural exercises, and of course, most importantly, continuing to modify your activities, limit and avoid the aggravating activities while this tendon is healing. It's like having a rock in your shoe. We can stretch the foot, we can strengthen the foot, but if we don't take the rock out of the shoe, it's not going to get better. So you really need to figure out how can you fix your aggravating activities. I swear I've had coffee this morning. I don't know why my brain is literally somewhere else. But yeah, that's something that I tend to really hit people with hard. Like, it's not about how consistent you are with your exercises only. It's also about the other stuff. It's about avoiding aggravating activities, modifying your activities to protect the tendon to allow it to heal, fixing any postural irregularities or weaknesses in other body areas. So I always recommend working with a physical therapist or occupational therapist, especially a certified hand therapist or a hand therapist if you can find one, because they're going to be really in tune with your body positioning, your posture. They're going to see things that you might not, and that can be really helpful in not only recovering, but also from preventing this from occurring again in the future. So that's going to do it for this video. Sorry, I got a little bit rambly. I know I'm trying to work on that, but I love to talk with you guys, and I'm just really passionate about what I do. So thank you for sticking with me this video. I hope that this series, Medial Epicondylitis, was helpful. I know I've had a lot of requests the past couple years, and I'm sorry it's taken me so long, but I hope this is helpful for you. Feel free to post comments, questions, anything like that below. If you enjoyed the video, please give it a thumbs up and subscribe to the channel, and I will see you in the next one. Thank you so much for watching.